I invite Dr. Parag Sharma to deliver his first talk.
Good afternoon. Due to the short of the time, as per the instruction of the scientific committee, I have to decrease my talk time. So today my topic is art and science of the performing GAT, including sterilization and calibration. So the tonometer eye test measures the inner pressure of the eye and also knows the intraocular pressure. The tonometer is carried out by the instrument called the tonometer. So it is by the two method, direct, indirect. We are discussing here about indirect method. That basic principle is applied force which either flatten or indent the cornea. So the ideal tonometry should give the accurate and reasonable intraocular pressure measurement. It should be convenient to use, simple to calibrate, stable from the day-to-day practice, and easier to standardize, and free from the maintenance problems. So the Applanation tonometer works with the Ebert-Fick law principle, in which pressure inside the sphere is equal to force required to flatten its surface divided by the area of the flattening. So basically, human eye is not ideally dry or flexible or thin. So to modify the law, and W plus A is equal to PA1 plus B. Here the A is surface tension and B force required to be in the cornea. So the cornea resists the flattening and the capillary attraction of the tear meniscus. And in this Godman tonometer, these two forces cancel each other out when the area of the flattening is equal to the 3.06 millimeter of diameter. This causes only minimal displacement of the fluid in the eye, and the pressure reading is unaffected by variation in this rigidity. So how we take the pressure? I will go directly through the video. So patients should sit comfortably in the chair unit, apply the topical anesthesia, and just align your prism, and the cobalt blue filter is nearly 45 to 60 degree. Just hold the patient's upper lid and rest it in the upper eyebrow, and that condition other eye should see straight, and meanwhile you can take the pressure. There is no squeezing, nothing is there. Then you will get the exact intraocular pressure, and just move the dial, and then here you are getting nearly 23 millimeter of mercury. So another video, how we will see this meniscus, or you can say Myers. This is a thin Meyer. So I told the patient, blink 1 or 2 so that fluorescence will spread nicely, and we'll get the typical ideal type of Myers. This is the end point where you get the cardiac cycle. At the inner point, inner circle has joined the inner part. So the ideal Myers. So the Applanation, the possible errors are like falsely high, low IOP, certain conditions like little fluorescence, thin cornea, corneal edema, and with the rule astigmatism and prolonged contact of the prism. And high IOP, you'll get too much fluorescence, thick cornea, steep cornea, or against the rule astigmatism. So still the Godman Applanation tonometer is a gold standard and accurate and reproducible, easy to use. So how we calibrate this Applanation tonometer? It is done at the dial position of 0, 2, and 6 is equivalent to the 0, 20, and 60 millimeter mercury respectively. This is a rod. If 5 marks, you see center point is 0. This either side is a 2 or 20 you can say, and the other side has 6 or 60 millimeter mercury. I will not go in the detail of this diagram. This process is only intended to verify the accuracy of the instruments. If the tonometer is inaccurate at any of this dial position, it should be returned to the manufacturer for the recalibration. So in the World Glaucoma Association, the recommendation is about plus minus 1 millimeter mercury in all testing level 0, 2, or 6. In APGS, the guidelines within is plus minus 2 in 0 millimeter mercury, plus minus 3 in the 20 millimeter mercury, plus minus 4 millimeter mercury in the position of the 60 millimeter. So directly I will go in the video, so we can save the time. See, this rod has, first is a 0, other is a 2, we can say 20 millimeter mercury, and then 6 or 60 millimeter mercury. Then you just keep it in the 0 and put this in the axis and see the calibration. Just you see the here is 0, and you have to watch the movement of the biprism. You see here this forward or backward movement of the biprism. Here you see the movement is in nearly I can say 10. So these tonometer have definitely error. So we should not do this. I was using this after 1.5 years. I calibrate these. That's why I got this mistake. And put it in the 2, and again you do the same procedure. Put it in the filler and see the movement of the biprism. Same, if in Indian standard, in Indian scenario, I usually do plus 18 or is not error, or plus 22. Means plus minus 2 in the 2 position is normal. So same thing you can repeat in the 6 or 60 millimeter mercury. So how do we clean the Applanation tonometer? The Godman Applanation tonometer prism tip can be whipped with the gauze soaked in 70% isopropyl alcohol and then dried before use. So another thing is either you do dry heat and mechanical cleaning with the disposable wipe style gauze, whip with this gauze soaked in alcohol or chemical like hydrogen peroxide or merthiolate. Soak this chemical like 70% isopropyl alcohol in 1:1000 merthiolate or 3% hydrogen peroxide and 1/10 dilute household bleach. Lastly, the ultraviolet rays or gas sterilization. So many of these methods may be unreliable. So should be, why we are doing this? Should be very effective in removing common offending organisms like adenovirus, herpes simplex or HIV. And this, when we are doing this sterilization, should not damage any part of the Godman prism like plastic or etchings, and should not affect the pressure reading point. So the there are 2 techniques. One is a whip technique and second is a soak technique. One is the whip technique, the prepared pad or gauze soaked 70% isopropyl alcohol is used to apply the tip of the prism for 10 seconds. The small video, the last. So this you can use either hydrogen peroxide or bleaching powder, and third is isopropyl alcohol. And just take it out the prism, and this any type of like tissue paper or paid gauze, you can just touch it. This touch it for the 10 seconds and dry it, and then again you can use the Applanation bioprism for the next patient. Thank you.
Thank you, Dr. Parag, for this